Welcome back to my class on nosodes and the sarcodes. We have learned some medicines which belongs to the nosodes, as you know, that they are from the diseased parts. But there are some medicines which have been prepared in homeopathy which are from the uh, healthy parts of the body. That's the natural parts of the body. And what is the concept behind the diseased part and the diseased part and preparing medicines both from the diseased part or the healthy part? Because the law of the similia is working everywhere. And basically, the law of similia has been kept into mind before discovering going into the nosodes as well as the sarcodes. Nosodes, the opposite of the health, and sarcodes, the positive of the health. So, what is the opposite? What is the there's a relation? What happens in one state, they get into the other state. So, this is the theme behind our understanding. So, in this concept, today we are going to learn about the sarcodes, which has been named as Adrenalinum. So, let me share the PPT so that we can get into the more information. So, this is adrenaline. Uh, you know what is from where it is procured? Uh, and adrenaline is a part of the endocrine system. As you know that I don't need to explain you about the endocrine system. So we have so many glands that produces some type of the hormones, and they have been termed as the endocrine system. And among these, there are many glands that like that thyroid, pituitary glands, and from all these organs, especially from the endocrine glands, the sarcodes has been prepared in the homeopathic medicine. This endocrine gland of the adrenaline, it is the extract of the suprarenal body, which is known as the adrenal gland. It is situated just above the kidney. And the chemical formula is C3H3A203, and it forms shining prismatic crystal, which melts at the temperature of 207 degrees Celsius, which is most soluble in water. So if you take the extract of the adrenaline gland, so this thing will happen that they will look like a prismatic crystals with which melting point is 207 degrees Celsius, and it is almost soluble in the water. So because we have to know learn the medicines, we must know that from where it is procured and what is the constituent, so that you can find a better applicability of these medicines into your practice. Adrenaline gland is a small gland that makes steroid hormone adrenaline. So from this we also understand the adrenaline is steroids also and not noradrenaline. These hormones help in control the heart rate, blood pressure, and other important functions of the body. There are two adrenal glands, one on the top of the kidney and other called the suprarenal gland. Just you see the picture here. So, see, just situated in the center, lower part of your abdomen, and where it is controlling, it has a control on the your heart rate, which is controlling your heart rate, your blood pressure. So, adrenaline has got direct impact on your heart. So, two distant area, and this is very remarkable for us to understand, because out of the anatomical structure, we usually feel that it is the normal, but why it is like that? Why the so it also gives you the insight that all the organs are interlinked and they have the affinity for the each and every part. And the two adrenal glands, they are situated at the two other areas. Then the two parts, adrenaline gland has two parts, that is cortex and the medulla. The cortex is the outer part of the gland, and it produces the hormone that is known as cortisol and adrenaline. The medulla, meanwhile, is the inner part of the gland, and it produces the hormone adrenaline and noradrenaline. So this is the anatomical structure of this medicine. And persons without, and now suppose this gland is removed, so what will happen? So you cannot live without, including the sex hormone and the cortisol. Although it is rare, you can have both of your adrenal glands surgically removed. That is used to happen to try the certain adrenalinum conditions. People who have this, their surgery, they take certain medications for life to replace the adrenaline. So hormone that is produced for your life, that is very essential for your life. And if it is removed from the body, you have to get a supplement of the adrenaline throughout your life. This usually happens because mostly in the cases of the cystic tumor tumor over the kidney, and that is usually removed by the surgeon. Some people think of getting it removed and they be out of the fear of the getting cancer, but it is not like that. Even if the cystic tumor are not so much harmful, please do not fear about the cystic tumor, which is I usually say that the cystic tumor are the dead type of the tumor, and there are no chance, at least almost no chances to grow and develop in the body. Now, what is the function of this adrenaline? So several functions are there. It is controlling your metabolism. It is controlling your blood sugar level. Most of the time, when the sugar happens, people you think that it is the insulin that is being produced by the pancreas, but without insulin, without adrenaline gland support, the insulin cannot remain proper. This is so blood sugar level, blood pressure is also maintained because it has got the sections of the heart. Then salt and water balance, pregnancy, sexuality development before and during the puberty. It has major role during the changes stage of your life. That means when you are from child, you are becoming the adolescent stage. At that time, its action is very dominant. And when you are becoming adolescence to the adulthood, and then again from the adulthood to the geriatric stage, this type of there are the certain. So I usually feel that adrenaline has got great affinity during the changes stage of your life, like a girl who is about to menstruate, so menarche is there, and then menopausal stage. At both the end, you can feel about the changes in the life, and these medicines can develop you, bring you a lot of the stress. That's why we also call it a stress response medicine. And then the balance of six hormones, including estrogen and so in every one of us, if adrenaline has got the characteristic feature for controlling both sex. In human, both sex, male and female, so both, and whichever dominates the characteristic of the feminine and masculine characteristics. So disorders affecting the and these are the disorders that you can. Then symptoms that you can see disorders: weight loss, muscle weakness, fatigue. These are the physical things that you are observing: darkening of the skin, headache, nausea, vomiting, diarrhea, craving for the salty food. Why salt? Why salt? Every time you notice some type of the thing, you can just ask question, why salt? Yes, salt is going to manage the balance of the water level in your body. Then mouth are sore, abdominal pain, and constipation. These are the very common symptoms that you can see as they start feeling without having any changes in the body. And you can think that now this is the precursor symptoms for the changes that is going to happen in our adrenal glands. The risk factor of the disorder of the risk factor that can come with the adrenal disorder, it is majority to the underlying autoimmune disease becoming incurable. Chronic disease including tuberculosis. So previous infections, surgeries that remove portions of the adrenal gland. Usually, when there is a surgery for the kidney done, some part of the adrenal glands are removed. So, autoimmune diseases like Graves' disease, lupus, or the HIV, and certain anti-sequel medications. So, these are very important things that you have to keep in mind, because by knowing the physiological features, anatomical position, you can interpret the symptoms and you can find the relevancy of the symptoms that is happening. And this type of the learning is very important when you have to practice and understand the homeopathic medicine. Uh, there are some other conditions like Addison's disease, that is the insufficient adrenal, then Cushing syndromes, congenital adrenal hyperplasia, excessive hair growth, hereditary, and primary adolescent Pons syndrome, and massive bilateral adrenal hormone Waterhouse syndrome. So many problems can arise responsible, and usually uh, whenever any hormonal system, hormones endocrine gland is involved, there are the problems. There are the problems which usually affect your entire system and your immunity problems. So, the early signs of the development of the problem from the adrenal glands are metabolic symptoms, unexplained weight loss or weight gain, fatigue, frequent high blood pressure or low blood pressure, sugar, weakness, immune system symptoms like frequent sickness or infection, blood pressure symptoms high or low, and then sexual characters development, reproduces growing facial hairs or balding or developing acne and having deeper voice and becoming more muscular. Now, as a homeopathic medicine, it has gone in some of the books you can find the two names, adrenaline or epiferine. Epiferine is also the another name for the active principle of the medulla of the suprarenal glands. Cortical secretions not yet isolated is employed as a chemical messenger in the regulations of the activities of the body. In fact, its presence is essential for the activity of the sympathetic nerve. Sympathetic nerve, you know, that it has, when what sympathetic means is come, that when whenever one thing happens at one point of the body, it also gets sympathetic. The other or part of the body also gets sympathetically. So feeling the same sense, this is the important thing. If you have the feelings, if you have the feelings as a problem, that you can feel that your kidney is also not working. If you have the feeling at the liver, you can feel that there some other organs are also. So two distinct organs. So in homeopathy, we have understanding about the concomitant symptoms. Symptoms appearing at the two end of the body, two parts of the body, which are not distinctly can be thought of, but they at the same time the symptoms are arising at the two parts of the body. And it has been suggested therapeutic, this is therapeutic suggestions that congestion of lungs, asthma, waist disease, the same things that we have understood earlier when we were learning about we have in the previous slide we have thought like that. So therapeutically, adrenal has been suggested in acute congestion of lungs, asthma, Graves and Addison disease, arteriosclerosis, chronic arthritis, angina pectoris, hemophilia, chlorosis, hay fever, serum rash, and acute urticaria. Dr. P. Joseph reports success in treating homeopathically case of angina and the aortic subacute chronic when adrenal has been prescribed at per OS and in foundational dose, the symptoms guiding is sensation of thoracic constriction with anguish. Thoracic constriction with anguish. This is with vertigo, nausea, vomiting are there, abdominal pain, shock or heart failure during the anesthesia, as it causes very prompt rise of blood pressure by the action of nerve endings in the vessels. Now, I have already told you about this. What is the features for this? So, it is a C3H3A203, and it is a shining prismatic crystals melt at the 207 point and soluble in water. It has got a bitter taste which leaves sensation of numbness on the tips of the tongue. Sorry, in dilute acid, it possesses marked affinity for oxygen, and when exposed to the air, it changes into oxyadrenaline, which is poisonous, though not possessing the properties of the adrenaline. It is uh, to this chemical changes that constantly occur in the tissue that have innocent effect of the drug is used. So, the, this oxygen, the balance of the oxygen is also important for your life. Whenever you have to, the balance of the oxygen is not there, you can think about this medicine. So a number of cases where Addison's disease has been cured. These are the things. Most of these cases are occurred in the practice of the other school also. They were also using, and very few have reported in homeopathic school. In fact, Raw says it has been unable to find the authentic case of this disease cured in his case. Why it is like that? Only because uh, that it is a lesser used medicine. People don't have usually think about this type of medicine. Only during the no-source conditions they can. Whenever only very serious physicians can think about the applications of the magnetic medicines like that. So physiological action, it is categorized and is a chief neurohormone or neurotransmitter of the adrenal medulla. It is sympathomatic actions that I have already told you, vasoconstrictions, vasodilations, then sphincters and stimulated, and it increases your metabolic rates, uh, breakdown of the stored fuel and productions of the substrate for the local consumption. It also contributes to the regulation of volume of the composition of extracellular fluid, promoting cellular uptake of the potassium in the kidney. Then it influences your secretion of the renin, insulin, as I told you earlier, also glucosamine, calcitonin, parathormone, and possibly testosterone. So it is responsible for stimulating the other organs to produce their enzymes. Even the digestive juices are also induced when it is. And in the viscera, especially the stomach and intestine, and in the uterus skin, it causes a constriction sensation, peripheral arteriolysis resulting in the rise of the blood pressure. And glandular activity promotes glycosuria, respiration system. So everywhere, whatever things I am mentioning, it has got the dual relationship. It is happening at one end and it is exposed at the other end of the body. So mental pictures, what will happen when your mind is divided, when your body is not functioning at one end, at two ends? Usually, you will have the no desire to work, cannot concentrate your work, your thought, despondent and nervous, lack of interest in anything because your mind is not stable. Things are not stable. No ambitions, no interest in anything. Disclinations for the mental work and absence of the dream. Then the head features, all headache are aggravated in the afternoon. Now this is peculiar for us to know the mental to the other parts of the body. And aggravations and ameliorations are very important modality. Modality and sensation must be tried to find out during the any observations of any symptoms of any medicine for any medicine. So aggravations in the afternoon or evening, and in the evening they appear at 7 p.m. and last until relieved by walking in the open air. So they are better by walking in the open air or by the sleep. Awake with headache over eyes and awake, awake with a headache is their sleeps are disturbed when there is a headache is there, and headache starts from the left side of the head and over the eye. So whether to open the eye wide and press them. So when they feel the headache, they will try to press their eye. So to get so pressing the eye, they find better with the headache. Brain feels swollen as though if your large skull is too large. Then burning heat in head, feeling as though he wanted to open the eyes. Then the congestion of brain during day, dull aching in eyeballs with headache, ameliorated by pressure on rubbing the eye. So whenever the pain in the head is better by rubbing the eye, touching the eye, pressing the eye, closing the eye, you can think about the. This is important concomitant that you can think about the adrenaline gland. And dull feeling in the head by in the evening, 3 p.m. to 6 p.m., and dull headache over the eye, fullness of the head. Then dull pain over the head, right-sided, left side, sometimes left-sided also, which extends to the eye, causing a feeling as though he wanted to open the eye wide. So the patient will usually come, doctor, I feel better when I keep my eyes closed, and it is difficult for me to keep my eye constantly open during the daytime. So whenever you can also observe the patient when seated before you in your clinic, what they will talk like this and answer, and most of the time they try to keep their eye closed because they feel better and they have got difficulty in keeping the eye open for a longer period. Then heat flushes of the heat in the evening or over the face and head, but face was slightly red. Frontal headache, supraorbital headache with congested nose and eyes, frontal headache, and then fullness of the head in the afternoon and the evening. Headache comes on at 11 a.m., lasting to 12:30 at the night, and it is better by eating. Headache better by eating has another feature is also important. Headache extending all over the head, but on aggravated on right the left side and over the eye across the forehead, and headache is extending to the ears. Nausea, heat in face without redness, aggravated in the evening, hot headache in the left side, extending to the right side, aggravated by reading and the morning, with feeling as though the eyes were strained. Appears if the headache appear at that 3 p.m., they are ameliorated by walking. So you have to particularly you have to note when at what time that things are happening. This is also important. So time modalities are here. You get the impression that the this adrenaline has got very much influence for the time modality. In eyes and ear, aching in the eyeballs, ameliorated by pressure, hypertonia of the conjunctiva dissipated almost immediately when they use logri, thus rendering operational side, pain in the eye, pressure on the eye, and the opening of the wide. Uh, every time the eye when you have got the then strained feeling, congested feeling, as though he wanted to open them wide or press upon them. Then ears, aching in the left ear accompanies the headache, sharp pain in both ears at times, itching and tickling in the right side, ameliorated by going into the ear with the finger. Nose, congested feeling in the nose, gelatinous mucus drops from the posterior layer and difficult to detach. On going out into the cold and a copious watery nasal discharge or aggravated by the right side when indoors, the nose is felt full and stopped up. So Outdoor they are better, but indoor their nose are become congested and slight stuffiness in the nose with full filling in the root of the nose feels flushed but it is not red. Flushes of heat over the head and face and flushes throughout the evening. So bad tasting mouth on waking. Mouth filled with a dark brown mucus has misty taste. Tongue clean, entirely, mouth are dry, and tongue coated white at time posteriorly, and tongue coated white red and red edge and the teeth. Then throat much hemming and walking to clear that every time they try to clear their throat. Right side swollen and sore, red and inflamed, aggravated by swallowing. Vocal cord are inflamed. So you can how you can find the vocal cord inflamed that when they are talking to you, the voice will be very tough, difficult to talk, speak also. They have got a ravenous appetite, increased thirst, increased appetite, belching after the meal, less thirst than usual first time for large quantity and increase in the. So many a time we say, how much water you drink? They will say large quantity. Then you say, but what time they drink? First they are large and it increases by the day. Less thirst in the morning daytime and more thirst in the evening. Nausea before meals, though appetite is good when he once begin to eat. So they don't want to eat, but when they start eating, they have got they feel better. Pain in the stomach passing from the right to left, coming and going suddenly. Sensation of nausea as though he would vomit, and rumbling in intestine like burbling going, rumbling is going on. Stool passage of the oval stool status, stool loose, brown, semi-solid, passed quickly with fetid odor, sudden spluttering type of the diarrhea all over in minutes, followed by burning in the anus. And the amount of urine increased, solid increased burns before the and during the micturations. Crystal of sodium oxalate increased, while sodium urate appeared during the proving and was very prominent. No casts are there. Hematuria with severe pain, so bleeding usually it has been these are the observed clinical symptoms of during the then first corpuscle will be present in your the pathological reports of the urine. No epithelia, strong odor or smell is very strong, hot and scalding, frequent profuse and pale, and sudden urgent to desire to urinate. Urine more frequently than the usual. And male genitalia emissions early morning without any bad effect. Erections lascivious dream all night causing them to awake. In sexual desire increase without erections. When the spermatozoa are present, sometimes they have got the urine is filled with the sperm at the beginning and during the first part of totally disappear. Then cough from irritation in supra uh, external fossa, expectorations of gelatinous mucus which is hard to detach and a sticky type, and increase of respiratory movement soon followed by suffocation and death from paralysis of medulla and pneumogastric acute. So extremities feature, aching in the limbs on waking. Every time you see the time modality is very much associated with the adrenal glands, arms and legs go to sleep easily. Numbness feeling that are not able to work. Numbness feeling from below upward, corns on the toe, dull pain in the arms and the legs. Left foot, leg and buttock goes to sleep easily and feel numb. This numbness extends to the both lower extremity but is aggravated in the left. left tired and achy. Then painful swelling of the first finger of the right hand, the first finger of the right hand, resulting in a ballon, and rheumatic pain in left elbow and little finger on waking, and severe cramps in right heels lasting 10 minutes. Then same in the left. So it gets the right to the left, followed by stomach ache. And slight rheumatic pains coming and going leg down leg, tired aching in arms and legs on waking, diffusion back, uh, uh, powerful locations for over the dilated blood vessels. So uh, local actions is there on the tissue. Feel contractions of the general muscular system. Repeated injections causes atheroma and heart lesions. Sometimes you can see this type of atheroma, the tissue becoming very hard or ulcerated with the heart in animals. The skin becomes bronzed, uh, great loss of strength, rapid emaciation, exceedingly rapid pulse, irregular intermittent heartbeats, general marked anemia. When injected into the circulation, arteries become contracted and blood vessels dilate down. And then pain, especially on the left side of the back, and then better by sitting or straight up or lying straight. Sleep dullness and sleepiness from 3 to 6 p.m. Great sleepiness and drowsiness, sleepy in evening and after the good night sleeps, and fever, flushes of heat over the face and the head. So, some of the books from where you can consult is also important. There is a very good book about the Nusos by Dr. H.C. Ellen. You can and when you want to study the say, no source, you must consult this book as a basic book for the no source. Then Metamedica by the John Henry Clark and Metamedica by the William Borick is also there. And Metamedica Viva, this is a beautiful book by George Whittle Ross where you can get understanding for it. So what is the essence? Uh, that combating such type of the disease which are seems to be or have become autoimmune. This is my final understanding. It is a remedy for which we could learn a lot. Should we be able to trace it in a high potency for animal or human under the stress in order to ascertain how far it could counteract such stress. Now, one thing is very the uh, about the proving of this medicine is not all has not been conducted in its origin. Basically, all the information that have been reported into the America are the clinical based testing. So it requires the more proving for on the healthy human beings also. Underlying stress and high blood pressure are very important. Adrenaline will be specific when the stress is an emotional, psychological nature and is connected with continuous subconscious stress, which has a first indication of elevation of the blood pressure. Lot of desire and inner unexpressed anxiety. So cases of paroxysmal tachycardia with high blood pressure are there. We may think about the neochromatic cytoma, renal efficiency, many positions. It is indicated in the case of cardiac infarct, angina, which is always mentioned. It is useful in the congestions of the lungs and urinary bladders, larynx, stomach, uh, etc. Then there is progressive loss of strength and loss of weight and eventually emaciation. The pulse is very rapid and strong. Then in Harrison's principle of internal medicine, very beautiful line is there about the action of the adrenaline. Tumors that produces adrenaline predominantly are associated with prominent sweating, This is the Harrison's practice of medicine. Palpitations, nervousness, tremor, weight loss, pallor, followed by flushing, heat intolerance, and rarely with the hypotension. Particularly, attention should be given to the three most common symptoms: headache, excessive sweating, and palpitations, since at least one of these symptoms is almost always present. Headache is the most common. The headache are abrupt in onset, severe, throbbing, generalized, and relatively uh, short-term. See, what a wonderful information is there, which represents the homeopathic thoughts in the Harrison's principle of internal medicine. And what our master says, when properly proved and understood, will I believe become one of the most major assets in combating contemporary disease such as hypertension, diabetes, paroxysmal tachycardia, with anxiety, arteriosclerosis, so many type of the incurable disease of the present era or the autoimmune disease. So this is wonderful expression by George Wickham. So thank you very much for my this adrenaline listening. I hope you can interpret more symptoms out of the things that I have mentioned here. I am not giving you the asking you to memorize it. I am asking you to try to understand and apply your logical understanding to develop the better understanding for the medicine. What the things of the symptoms needs interpretation to be discovered and applied for your practice. So I think it is you have some insight into the adrenaline and how much important it is there and how much interesting it should be when you find a patient coming to you and you have selected the medicines and that medicines is not working, and at that time you have to think that I must think something into, because Dr. Henneman has already mentioned, when you the things which is getting better but soon it returns, they are relapsing, recurrent type of the things are, and the alternating states. All these states are indicative that something is missing, that the background is missing, on which the disease conditions is based, that has to be taken consideration. And usually they are not observed as a observed symptom. You have to find it out from the interpretations of these observed symptoms through the baseline of the patients. So I think I should stop here now, and we can think about the medicines later on, other medicines also. So thank you very much.